And it's my pleasure to introduce and welcome Dr. Amanda Doyle, who is the Chief Officer for Healthier Lancashire and South Cumbria. Amanda.
Morning, everybody. It's nice to see so many people here. And I apologise to those who've heard me speak before, because I feel as though I just keep saying the same thing over and over again, and even I'm getting quite bored, but I'm still going to say it. So our job as an integrated care system in Lancashire and South Cumbria is we've got three things to do. Really quickly, we've got to improve the health of our population. It is dreadful. People live shorter lives, people live less healthy lives, even within our patch. We've got huge health inequalities. We've got some of the worst life expectancy in the whole country in parts of our patch, in Blackpool and Blackburn. And even while people are alive, we have a higher incidence and prevalence of long-term conditions, of lifestyle-related disease, of things we could do something about. So we've got to improve the health of our population. We don't get the clinical outcomes from treating people when they are sick that are as good as they could be if we organise the way we deliver care differently. So when people are sick, we could do better for them in some cases. Even though the care we offer is really good, there are some things that we could do better if we organise the way we deliver care to them in a different way. And that's particularly the case for things like stroke, for some cancers that we don't diagnose quickly enough or don't coordinate the care we offer in the right way. So we could improve health, we must improve health, we could improve clinical outcomes, and we've got to do it within the resources available. It's very easy to design a system that does everything for everybody and achieves the best possible outcomes and really, really drives up health if you've got unlimited resources. We haven't. We've got to do what we need to do within the resources that we've got. So how are we going to do these things? Well, we're going to integrate. And everyone just rolls their eyes and says, what's she on about now? It's the latest buzzword, integrated care systems. What's one of those? Why is it going to be different? And why is it going to help us do those things we need to do? If you look in a dictionary, what integrate actually means, or the definition from a dictionary that I like best, is to combine two or more things in order to become more effective. And that's what we are going to do. We are going to combine the resources and organisations we've got in order to do our job more effectively. And we're going to do that at several different levels. We're going to do it in neighbourhoods, in our neighbourhoods which are communities of 30 to 50,000 people based around primary care and out-of-hospital services. We are going to combine our GP practices, our community teams, our therapists, community nurses, mental health teams, social care teams, and the voluntary sector organisations and community and faith organisations that work in those neighbourhoods are going to combine their resource to deliver care more effectively to that population within the neighbourhood. In our integrated care partnerships, so our health economies, Fylde Coast, Morecambe Bay, Pennine Lancashire, Central Lancashire and West Lancashire, we are going to integrate, we are going to combine our organisations vertically, combine the resources of our out-of-hospital system, our hospital services, our social care services, in order to become more effective at delivering care in and out of hospital for the population within those integrated care partnerships when they need it. And then on an integrated care system basis, in Lancashire and South Cumbria, we are going to integrate and combine the resources we've got to deliver the best care in the most effective way for 1.7 million people. And at that level, the things we need to bring together are much more about specialist hospital services, some of the services that are very specialist, but also some of the services which are really quite fragile, services we don't have the workforce to deliver 6 or 7 or 8 times in different places. We need to bring together our resources to have effective pathways to do the things that can be done most effectively once for a population of that size. But doing all of that, however well we do it, and we're starting to do it pretty well now, we're really starting to see a difference. But however well we do it, what that will result in is largely improving clinical outcomes, really. So we will be improving the care we deliver one patient at a time. People will get better outcomes because we organise ourselves differently and deliver care in more effective pathways. But we're not really going to improve health in our population by doing it one patient at a time, by improving clinical outcomes for sick people one patient at a time. We're only really going to tackle the first of our aims, the aim to improve the overall health of our population, by doing it at scale, by doing it 1.7 million patients at a time. And to do that, what we need to do is have a step change in not only how we integrate our organisations and our staff and our teams, but what we do with our data. We need to combine our data and our information and the way we use it to become more effective. So we've got here an electronic lifelong health record on the same clinical system for 1.7 million patients. That is the holy grail of managing population health. There are systems all over the world that would give their right arm to have a lifelong record on the same system for every single person that lives in their geographical patch. And we've got it, and we don't use it. We don't combine it to make the way we use it effective. We share it a bit now, and we're getting better at that, and that helps us deliver better clinical care, but it doesn't help us improve the health of the population. And that's what today is all about. That's what population health management means. So it's another of those things that everybody's bandying around and talking about doing. But if you ask most people in our systems, they don't actually know what it means, and they don't know what's expected of them. But it sounds really good, so we'll all do it. What it's got to mean for us is combining all of our assets, our information as well as our staff, as well as the way we use that information to target our resources and interventions effectively so that at scale we improve the health of our population. And actually look, and we can do it at all those levels I talked about. We've now got systems that allow me to sit in my GP practice in Blackpool and tell you which particular long-term conditions are going to be most prevalent at what age in the people who live in that neighbourhood. And there's about 30,000 people in that neighbourhood. And I can look at the information we've got and tell you the age at which most of them will become hypertensive if they're ever going to be hypertensive. The proportion of the diabetics in that neighbourhood who are going to become depressed as a result of their long-term condition at that age. And then we can target and we can screen and we can search out patients and we can deliver services or configure services in a neighbourhood or in an ICP which actually target the needs of that population. What we need to do are two things. We need to understand what we can do with the stuff we've got, with the data and information we've got. We need to use it intelligently, but then we need to step up from, I suspect today we're preaching to the converted in this room. The people who come to this sort of thing are the people who really understand what can be done and want to do it. And what we actually need to do is move from having fantastic information, intelligently analysed, presented in really nice graphs and charts and everything else, and kit that enables us to do things better, and move into getting all of our colleagues to actually work differently, to use this stuff, to understand what's possible, and to work in a way that's really, really going to improve the health of our population. So that's the challenge for all of us today, only a little one. Go away, use what's available, and integrate. Combine all of our assets to do what we really need to do, which is to improve the health of the population. And for most people in this room, that population in Lancashire and South Cumbria is not an anonymous group of unhealthy people. It's us and our families and our neighbours and friends and colleagues. And actually that's a huge incentive to us to go away and do what we can to actually do something about the health in that population. So thank you for coming. There's some really good stuff to listen to, and enjoy the day. Thank you.